ROBYN WARE has 10 grandchildren. Her youngest is 10-week-old Billy.
Good man. I can't pick him up because I can't bend over.
Here you go. Yeah. He's home.
With my grandchildren, the saddest thought for me is, because they're all so young, that they will only remember me as a croc. And I had great thoughts, dreams, I suppose, that I would be able to do things with them. Anything, everyday things, but I can't.
5 years ago, after she was diagnosed with scoliosis and told her back was worn out, ROBYN underwent spinal surgery.
I remember the surgeon said to me, you'll be normal. At the end of this, you'll be normal. There are 23 screws and 3 rods.
The procedure was a spinal fusion. There were complications, including infection.
The pain was all-encompassing. It took over my brain.
Spinal fusion is a procedure in which 2 or more vertebrae are permanently joined to stabilise the spine. In 2017-18, close to 18,000 fusions were carried out in Australia. It's one of the most common forms of surgery for chronic back pain. But there's a growing debate about whether surgery is the best way to treat most back problems.
It's a low level of evidence that we accept, and I don't think that's good enough, particularly for highly invasive, risky and costly procedures like spine fusion.
In the correctly chosen patient with appropriate pathology, you can have very good outcomes from spinal fusion.
That whole time that I did have back pain, I was looking for that quick fix.
Steve Durrell is back at hockey training after a tough few years. He hurt his back working on a building site.
My back was seizing up and it was quite scary. I wouldn't be able to walk without my leg dragging behind me.
In the end, Steve had 3 operations, the final one a spinal fusion.
I'm feeling no relief from these operations.
Steve Durrell says a 6-month physiotherapy program achieved what surgery couldn't, treating his back pain and helping him return to sport and work.
If I had my time again and doing this whole process, I would definitely explore other options than getting surgery to start off with.
In 2017-18, 1 in 6 Australians had back problems. That's 4 million people. In certain cases, such as pressure on the nerves or a fracture, specialists believe surgery is the best option. But there's now a push for treatments such as physiotherapy when dealing with non-specific pain or degenerative conditions.
My views have definitely changed over the years on spine surgery.
Professor Ian Harris has been an orthopaedic surgeon for more than 20 years. He no longer operates on backs.
I realised that the evidence wasn't very supportive and it wasn't very strong. And in fact, for many of the procedures that I was performing at the time, there was evidence that they probably didn't work.
Neurosurgeon Jonathan Ball believes surgery remains a legitimate option.
There is maybe a certain subset of patients with back pain where surgery can be beneficial. And it's important just not to say, because surgery is not right for all back pain, that we just say no surgery for any back pain.
The system incentivises procedures, and so things like surgery are rewarded per operation you do. So surgeons make a living from doing operations. There's very little support, say, for non-operative management of people with chronic back pain.
Critics suggest that surgery is a money spinner for surgeons. You get money if you do an operation. So is that a motivation for some surgeons?
There may be a conflict of interest in that if you get paid to do something, you will do it more often. But I would hope that all surgeons would try and minimise that risk, but there's the potential that that may be a driver for some surgeons.
Certainly for me, it's been an amazing outcome.
A year ago, Tracey Leslie feared her riding days were over, when excruciating back spasms meant she could barely walk.
It was like being 90 well before I was. I would know within 2 or 3 strides of walking whether I was going to be able to ride that day or not. And it got to the stage where every day was like that, so I just stopped.
I'll grab another roll up in a second.
Physiotherapy didn't help, so Tracey consulted Dr. Ball, who performed spinal fusion surgery.
An immediate difference. The pain was gone almost straight away.
After a steady recovery over several months, she's back in the saddle and hoping to return to dressage.
Now that I'm feeling better, our aim is to get out there and start competing, hopefully in the second half of this year. It's amazing. It really is.
Despite success stories like Tracey's, a growing number of health professionals believe there is a better way.
There is evidence that structured physical therapy programs or even cognitive behavioural therapy is as good as spine fusion for people with chronic low back pain.
Turn to the right. And again. Good. It is very hard when you've had a fusion because you're going to bend over the top of your fusion. By the time I see them, they've usually had an adverse response to their surgery. It hasn't been successful, and they've been soldiering on trying to improve themselves, and they're in a pretty bad way. Behind your head, elbows back.
Physiotherapist Jenny McConnell first saw ROBYN WARE 9 months after her spinal fusion.
Actually, we'll just come over to this wall, might be easier. When I first saw her, she could barely walk. She was told that if she didn't have a fusion that she would be wheelchair bound. Now the problem with low back pain is it's not cured, it's managed. And if you think you're going to fix the problem, that is a really bad way to look at it. So it is a lifetime of looking after your own back. And if you are given management strategies, you will go much better. So you're feeling that working.
With ongoing physiotherapy, ROBYN is slowly improving, but she wishes she'd known sooner there was an alternative to surgery.
Hasn't stopped.
Yes, it has. Yes, I could say I wish I hadn't had it, because what had happened is 10 times worse than childbirth, and I've had 4 pregnancies. So it was much, much worse than that.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.